Subcommittee will come to order. I want to welcome everyone to today's hearing on the President's budget and other bipartisan proposals to reform Medicare. This is the fourth hearing for our subcommittee this Congress and the second Ways and Means Committee hearing in a series focused on proposals to reform Medicare and Social Security. During our first hearing of Congress, we focused on redesigning the Medicare benefit package to make it more rational, more responsive to seniors and Medicare patients. Today's discussion is an extension of that hearing, discussing the details around these three specific policies. One, increasing income-related premiums for Medicare Parts B and D, increasing the annual Medicare Part B deductible, and establishing a home health copay. We focused on these three policies because they're included in the President's 2014 budget and supported by several bipartisan organizations. All too often recently, discussions surrounding finding Medicare savings have come under the context of a grand bargain or a super committee. As a committee of jurisdiction over these critical topics, we have an obligation to discuss them publicly and determine how best to craft policy in these areas. And that's why we're holding this hearing today. The President's budget estimates that these three policies will save $54 billion over 10 years. These are real savings for a program that is facing bankruptcy in 10 short years. Asking seniors to pay more when they have the means to do so is not a new concept. In 2003, Republicans led the charge with income-related premiums for Medicare Part B and D in the Medicare Modernization Act, which ensured that seniors have access to accessible, affordable, high-quality medicines through free market competition for their business. In 2010, Democrats included income-related premiums in the Medicaid program, health exchanges, and the increases for Medicare Part D in the Affordable Care Act, known as Obamacare. Throughout federal programs, there has been recognition that some seniors can contribute more and some seniors need additional assistance. The growth of the retiree population has been and will continue to be a tremendous source of stress on Medicare's finances. When Medicare was enacted in 1965, the average life expectancy was 70.2 years. It was anticipated that Medicare would cover an average person's health expenditures for the last 5.2 years of their life. In 2010, the average American lived to the age of 78.4, which means Medicare covered the last 13 and a half years of life, a 158% increase. Yet, we've not made changes to the Medicare benefit structure to address this increase. Now, I know that some may want to reject these policies out of hand and may suggest that the overall Medicare spending per senior has decreased. They may contend that this means there's less of a need to find Medicare savings. But I, too, am glad to see Medicare spending is down, but the program is headed toward bankruptcy in 10 short years. Burying our heads in the sand and waiting for the looming crisis to overwhelm us will only force future Congresses to take more drastic measures. Even the Medicare trustees recognize the growing challenges of Medicare's financial future as the baby boomers enter Medicare. Even if per senior spending decreases, that will not help the sustainability of the trust funds when the number of new seniors coming into the program begins to dramatically increase. And simply cutting providers is not the answer. In fact, the Medicare trustees warn because of cuts already in law, 15% of our Part A providers will be unprofitable by the end of this decade. Roughly 40% would be unprofitable by 2050. The actuaries warn that these cuts will force providers to withdraw from providing services to our Medicare seniors and patients. Finally, instead of simply focusing on how much money a policy might save Medicare or how many more beneficiaries will pay more, I challenge this committee and our witnesses today to think differently. The question we should be asking ourselves is, how can we act now this year to extend Medicare solvency? If not permanently, how about for an additional 10 years beyond 2023? Why not extend its life an additional 20 years? We owe it to current and future seniors to examine and pursue these critical goals. It will require hard decisions, yes, but making them now will ensure a vibrant Medicare for generations to come. Before I recognize Ranking Member McDermott for the purposes of an opening statement, I ask unanimous consent that all members' written statements be included in the record. Without objection so ordered, I now recognize Ranking Member McDermott for his opening statement.